We often think of obesity as a quality of life issue for dogs. Extra weight slowing them down, making them less active. But what if I were to tell you that obesity is doing something far more dangerous? It is literally reshaping their hearts. I'm Dr. Laurie McCauley from Optimum Pet Vitality, and I recently reviewed a compelling research article titled The Effect of Obesity and Subsequent Weight Reduction on Cardiac Structure and Function in Dogs. That's a mouthful. But the findings were clear. Obesity leads to significant structural changes in the heart. Weight loss can reverse some, but not all of the damage. Early intervention is crucial to prevent irreversible heart disease. As a veterinary professional and advocate for evidence-based pet care, I believe this research needs more attention. Here's what every pet owner, veterinarian, and industry leader should know about canine obesity and cardiovascular health. Obesity is one of the most common and preventable health issues in pets today. Studies confirm that excess weight is linked to chronic volume overload, so the heart has to work harder to pump blood through all of that extra tissue. We see left ventricular hypertrophy. The heart muscle thickens, particularly the interventricular septum and the left ventricular free wall. We see diastolic dysfunction, so the heart's ability to relax and fill properly is impaired. Every obese dog that was studied had this issue. We see mildly elevated blood pressure, so the systolic blood pressure was greater or equal to 160 millimeters of mercury. More than half of the obese dogs had increased systolic blood pressure, though the study does suggest it could be due to stress rather than just the obesity itself. So these findings align with human cardiology research, where obesity is strongly linked to hypertension, heart failure, and increased cardiovascular risk. But the critical question is, can weight loss reverse these effects in dogs? Researchers conducted a controlled weight reduction study on 24 client-owned dogs with obesity. 12 successfully reached their target weight and underwent advanced cardiac assessments, including DEXA scans, electrocardiography, and biomarker analysis. Here's what they found. Weight loss did significantly reduce the left ventricular wall thickness. Systolic interventricular septum and left ventricular free wall measurements improved, confirming that some cardiac remodeling is reversible with fat loss. But the diastolic dysfunction did not improve. Unlike in human studies where weight loss often restores diastolic function, these dogs still showed signs of impaired relaxation post-weight loss, and no significant change in blood pressure or heart rate variability. Despite earlier concerns, heart rate variability was not lower in obese dogs, nor did it change with weight loss, suggesting that sympathetic nervous system activation may not play as large of a role in canine obesity as it does in the human research. But this study is a wake-up call. Obesity isn't just about mobility or joint issues. It's a major cardiovascular risk factor for dogs. But while some damage can be reversed, not all of the effects are temporary. This means that veterinarians, pet owners, and industry leaders need to take a more proactive approach to weight management. Early intervention is key because 1, preventing obesity is easier than reversing cardiac changes. 2, diastolic dysfunction sets in, it may not fully recover even with weight loss. And 3, standard obesity treatment plans should involve cardiovascular monitoring, not just weight loss goals. This research highlights the need for comprehensive obesity management protocols in veterinary medicine. Simply reducing calories isn't enough. We need a holistic approach that includes cardiovascular screening and tailored exercise plans. If you're a veterinary professional, this study reinforces the importance of early weight intervention to prevent long-term heart damage, incorporating cardiac assessments into our weight management programs, and educating pet parents on the hidden dangers of obesity beyond mobility issues. If you're a pet owner, this research is a reminder that weight loss isn't just about helping your dog move better. It's about keeping their heart healthy for years to come. If your dog is overweight, now is the time to act, before heart disease becomes irreversible. Work with your veterinarian to develop a science-backed weight loss plan that If your dog is overweight, now is the time to act, before the heart disease becomes irreversible. Work with your veterinarian to develop a science-backed weight loss plan that prioritizes fat loss while maintaining muscle mass. Obesity in dogs is more than an epidemic. It's a silent cardiac crisis. This study adds to a growing body of research showing that we need to take obesity prevention more seriously in veterinary medicine. We must shift the conversation from, overweight pet's just a little chubby, to recognizing that obesity is a serious medical condition with lasting effects. What are your thoughts on canine obesity and heart health? Should cardiac screening be part of a standard weight management plan? Let me know your thoughts in the comments, and I'll see you next time.